Okay. Good afternoon, everyone, and welcome to the Hywel Dda Annual General Meeting. Hywel Dda a croesi I gyfarfod cyffredinol Blenydd Hywel Dda. Thank you, everyone, for coming, and thank you for those people who are watching this on live stream. I'm just going to do a very brief introduction and then we'll hand over to start the presentations. First of all, I'd like to say it's a real pleasure and an honour for me to be here to introduce the AGM in my role of interim chair. It's been quite a journey since the time I took over the interim chair role, and I am delighted that the Health Board is going to be welcoming Maria Battle to our new chair role later in August. The format for this afternoon will be that the presenters will present their items and then we will take questions at the end of the meeting. For anyone in the audience who wishes to ask questions, there will be microphones to ensure that we can hear you. So, diolch, thank you. Before I hand over to the Chief Executive, just some formal apologies from Delyth Rainsford, John Gubber, Phil Clore and Karen Miles. Thank you.
Thank you, Judith, for the introduction, and it's lovely to see so many faces in the room, most of which are familiar, some new faces. Welcome to members of the public who've been able to join us today, and I hope we've also got many watching us on the web streaming. So today is about a bit of a review of our previous year. I guess the first thing to say is, as with pretty much every year since I've been here now, and it's been 4.5 years, time flies when you're having fun, it's been another hugely momentous year for us as an organisation. And firstly, I think it's important for us to acknowledge in that year the huge amount of hard work of our staff. And everything that follows from this slide, just to recognise behind that are our staff working hard every day to deliver great care to our patients. And as I've said many times over the years in many public forums, I think a key role for our board is to ask ourselves every day how we make Hywel Dda a great place to work. And that's never finished, but I think we spent the last year making some progress on those things, as well as improving on our overall performance. In terms of that performance, I'm really glad to say that our performance has continued to improve. We had a significant milestone in 2018-19 where from a position where we had more than 7,000 people waiting for our care over 36 weeks, this is for our elective care services, we managed to get that down to 0 at the end of March in 2019, and that was a significant step forward for us. I remember in the early days of the Health Board when we were out talking to patients, just the number of people who were telling us about how long they were waiting, often their lives on hold. Being able to achieve that with significant Welsh Government support, I would add, has been important, I think, both for the staff who've been able to deliver that and for the patients we serve. We also, of course, it wouldn't escape anyone's notice, have delivered our first ever strategy as a Health Board, setting out our vision not just for the next few years and not just for parts of our service, but actually a vision for the entirety of our services and beyond the traditional boundaries of healthcare into social care, into how we work with our communities and the third sector. A really ambitious plan which will drive us for the next 20 years and is both exciting, but I would probably also say quite daunting. And I think over future years in our AGMs, being able to report back on progress with that will be of interest to everybody. But we are determined to see the change that we've set out come about, focus on population health, a focus on a move to a social model for health, about how we support our communities to stay well, and a reconfiguration of our hospital system so that it's there when people need it in times of crisis. And of course, the other thing last year, which was hugely important to us, was our financial position. For many years, the organisation has been one with a narrative of challenging finances, often getting worse year on year. Last year was the first year in which we were able to reverse that trend. We reduced our deficit in like-for-like terms by about £7 million. Still a very long way to go, and I'll set out a bit of the future in a later slide. But that was an important moment for us to demonstrate that we could both improve our services, improve our support for staff, but also start to reduce our deficit. The next slide takes a lot of clicking, but I just want to give a sense of the scale of the organisation and the sort of things that we deliver. So I'm just going to put them all up at once and allow you to absorb the numbers. As I said at the beginning, every one of these numbers is a care interaction between our staff and a patient. And whilst you can see the range of ways in which we do impinge on people's lives, we should never forget that it's that human-human contact and the quality of that which is important, and making sure that every one of those contacts is meaningful and useful to our patients. I'm going to follow now with a video which probably much more eloquently than me will summarise the year, and I've been told if I just click this button it's all going to work perfectly, so bear with me. Said I could do IT. So just a few more highlights from me for the year that's in review. I would just want to highlight the process of our consultation this year. The way in which we undertook that consultation, the depth and level of discussion we had with the public, I think did stand us in good stead for the board to be assured about the strategy that came forward, having been fully, honestly, openly and humbly consulted upon. And that's something I think we all want to take forward absolutely into our future. The fantastic news around Eve Lightfoot, she was at the board with us recently, who was named RCN Wales Nurse of the Year. Fantastic achievement, and the stuff that Eve has done has been great for the health board in her rollout in the community. We've also been rolling out things like our 111 service and secured £12 million of transformation funding, which will help us to start to leverage the change in the future that we've set out in our plan. And, you know, we shouldn't forget the important work of our volunteers in all of this. We've been able to recruit more volunteers, but also for those who have spent time with us as volunteers, been able to support them into other opportunities going forward. And again, we see that as really important to grow into the future. If I can just spend a moment, although this is about a review of 2018-19, just looking at 2019-20. As I mentioned at the beginning, We still have a need to ensure that we drive down our financial position. We've been set a challenging but achievable target by Welsh Government this year to reduce our deficit to 25 million, a further improvement on last year. And we're working on that every day. There are real challenges with that, but it's something we are determined to do. And we are also making those strides and turning this organisation from one of turnaround into one of transformation. And the board will know, and for those who do read our board papers, just last week a discussion around a portfolio of programmes which supports everything that we're doing across the health board and moves us away from that sort of focus on turnaround as a separate issue. And we are also, as I mentioned, in the early days now of driving the delivery of this strategy that we've set ourselves, this exciting but daunting strategy that we've set ourselves, and now moving very concertedly into delivery mode. And for the public to start to see on the ground the kind of commitments we made at our board meetings last September and last November about changes, particularly in our community services, as we move forward. And again, a focus for us on ensuring that the good performance improvements that we made in 18-19 continue to be driven into the current year, and ensuring that the time that people are waiting for our services is reduced wherever possible. That's an ongoing challenge for us. So I would just encourage members of the public who are listening to this or in the room with us today, do have a look at our annual report. There is a lot more detail in that. It details, as I've mentioned briefly, but much more detail around our performance report, around our accountability report, which sets out all of the things we've been able to do. We've tried to make it easy read, accessible, interesting for people to engage with, because as an organisation, I think one of the hallmarks that we set ourselves is one that wants to be open, transparent, both about our challenges, but also about the opportunities and our plans for the future. And for those of you who like finances, do have a look at the financial statements. They're always a fascination to me. And we're going to ask the Director of Finance to come and present on those in a moment. And, of course, the annual quality statement, because running through all of this is a need to ensure that we focus on the quality and safety of the services that we provide, both today, recognising some of the challenges that we face, but also into the long term, how we make ensure that this organisation is one that it has a hallmark of quality and safety right through it. And the Director of Nursing will take us through some of that in a moment. So I think if I've done this right, I'm now going to hand over to the Director of Finance to take us through the financial statements.
Thank you. Well, Chief Executive, if the finances are a fascination to you, then you're ready for a treat here. I'm just going to say a few words in Welsh, if I may, just to start, and then I'll repeat it in English, and then I'll go into give a presentation on the financial overview. Mae yn rhydedd mawr I fi fan hyn cael fod o'ch blaen chi fel cyfarwyddwr cyllid I rhoi'r rhagolwg ariannol I chi a I gyflwyno'r cyfrifon. Yn arbennig I fi, yn broffesiynol ac yn bersonol, mae hwn yn ardal sydd yn agos iawn at yng nghalon ni. Ges i'n geni lan yn Bronglais, mae'n heili wedi cael triniaeth yn Glangwili, mae da fi berthnasau sy'n gweithio lawr yn Llwyn Helig, felly mae hwn yn ardal sydd yn bwysig iawn. A felly mae cael bod ma'ch blaen chi I roi'r adroddiad ariannol yn rhywbeth pwysig iawn yn bersonol. Mae llynau wedi bod yn flwyddyn mawr i'r Bwrdd Iechyd, yn strategol fel nath y Prif Weithredwr sôn, o ran yn perfformiad ni, o ran yr arian ac o ran ansawdd. Yn strategol, am y tro cyntaf erioed, fe wnaethon ni fel bwrdd cymeradwyo ein strategaeth clinigol. O ran perfformiad, I ni wedi dod lawr ar nifer o bobl sy'n disgwyl yn fwy na 36 wythnosau lawr I ddim. O ran arian, am y tro cyntaf eriod, i ni wedi lleihau'n diffyg ariannol a dod o fewn terfyn ariannol a sodwyd gan y Llywodraeth. Ac o ran ansawdd a wneith y cyfarwyddwr nyrsio siarad yn fwy am hynny yn y man. A felly mae rhaid i fi diolch o galon i aelodau'r bwrdd sydd ddim yn cael diolch yn aml iawn, i staff Bwrdd Iechyd sy'n gweithio yn ddiflino i weithio ar rhoi gofal gorau yn cleifion ni a hefyd edrych ar ôl yr arian. I'n gwirfoddolwyr hefyd sydd yn gweithio yn ddiflino i gynorthwyo'n cleifion. A hefyd un partneriaid sydd wedi bod na gyda ni dros yn taith ni ar y flwyddyn diwetha a'r cyhoedd a'n cleifion ni sydd wedi bod yn dewis yn ddoeth i ni. A mae hynny yn beth bwysig iawn. It is a deep personal and professional honour to be here as Finance Director presenting this year's annual accounts. It's a part of the world that's clearly very important to me, and the roots, my personal roots and roots of my family run very deep. I was born in Bronglais. My family have had treatment in Glangwili in Prince Philip, and I've got relatives who work, or a relative who works in Withybush. So there is a real sense of a community in this part of the world, and I'm deeply honoured to be a part of the service. This year has been a very significant year for the Health Board. Strategically, as the Chief Executive mentioned, in terms of having for the first time now an approved clinical strategy to drive us forward. In terms of performance, where we now no longer have people waiting longer than 36 weeks for treatment. In terms of quality, and I won't steal the Director of Nurses' thunder in talking about quality, but significant moves ahead in that area. And of course, in terms of money, where we have, for the first time, brought down our deficit as a health board and brought it down by a significant margin, as I'll go through in a moment, but also come within the target set by Welsh Government, which was a huge achievement. And the thanks for that go to the staff who work in the Health Board, who work tirelessly day in, day out to provide excellent quality services to our patients, but also look after the money and do that in a cost-effective way. To our volunteers who support us tirelessly throughout the year. To our partners in the third sector, in local authorities, who are there with us, by our side, working hard for our citizens. And for the public and our patients who choose wisely. And that choosing wisely makes a huge difference to make sure that our service is there for those who need it most when they need it the most. So, I would like to just take you through a few slides on the financial position for the last year. The first thing to note is our expenditure of £920 million over the year is our gross expenditure in this part of the world. And that's made up of two chunks. 829 million comes from Welsh Government as our funding, and 57 million of income is generated locally. That's income generated from patients who come from out of the area in to be treated here, from patients who come from overseas, from some private patients, and rental income of various sites. But we have had a deficit, and that deficit was 35.4 million for the year against a plan, as I mentioned, 35.5. This year was a significant year for us in that Welsh Government commissioned a review into the costs associated with providing healthcare in our communities and concluded from that review that the Health Board required an additional resource allocation of 27 million for the year, and that resource has been agreed and provided on a recurrent ongoing basis for us. So with all that put together, and even after accounting for the additional funding from Welsh Government, we reduced our deficit by 7 million within our own resources. And that's a significant achievement for us as a health board. I can see the turnaround director at the back there, and he certainly worked very hard throughout the year to deliver some of the changes that needed to be made. But that represents a very significant team effort across the board in terms of our independent members who've been there to give us constructive challenge, to fellow executives who've been focused on delivering good quality services within our resource allocation or within our budget, and to our population as a whole. So, just in terms of a very brief summary of our position, we've not been able to approve a medium-term, a 3-year medium-term plan for the last 3 years. We are working hard now with a clinical strategy in place to develop a 3-year plan for the coming period. But that has been a challenge without having a strategy in place. And partly linked with that, and partly causing that, we've not been able to contain our resources, our expenditure within the resources which have been allocated to us for the cumulative 3-year period. And you can see there that while we reduced our deficit on an in-year basis last year, the 3-year cumulative position didn't reduce, and that's because it increased much more significantly than that back in 16-17. So that's had a counterbalancing impact. But that is clearly a significant legacy of concern for us. Having said that, we have been able to contain and manage within our resources in terms of capital, and we've been able to prepare accounts which consistently give a true and fair view of the state of the Health Board's finances. And that's an important piece of assurance for the board that even though the financial position hasn't been what we would want, you're getting a picture that is true and fair as a representation. And there are a number of statutory targets. The only statutory targets we have, are the 3-year plan and to contain our expenditure within our resources over 3 years. There are administrative targets that support that, one of which is our in-year break-even position. And as I said, we had a deficit of 35.4 million last year, but still represents a significant improvement on the 69 million recognised in 17-18. And of course, the other targets we have are to pay our suppliers on time, which we've achieved in the latter 2 years, and to keep our cash flow in the limits set by Welsh Government, which again, we have achieved. I won't go through this chart in any detail, you'd be pleased to know, but it just represents the allocation of resources that we've had in terms of those blue lines up to our total of the resource allocation, and then how that has been consumed then to represent the costs in primary care, in other providers, and in our hospital and community services, the biggest element of which, of course, is our staff. I just want to reference the efficiency savings, because this does represent a significant change in the way we're providing services now, in a much more, providing much more value and efficiency in our finances and in the services that we provide our population. And there are some significant areas of savings there, not least medicines management right at the top, which has contributed significantly to the Health Board savings challenge last year. So in total, we delivered around £26.6 million worth of savings, which contributed to that reduction in our deficit. Just moving on to capital before I close. We did spend a significant amount on capital over all of the kind of areas that we serve. And 30.9 million over the year, starting up in Bronglais there with the MRI scanner, which is due to come on stream this year, but we spent 300,000 last year with more to come this year. Coming down the coast towards Aberaeron with Mineiron, which is about to open, the Integrated Care Centre, spent 1.5 million there last year. Again, more this year to reach conclusion. And the very stunning building there in Cardigan with the Integrated Care Centre, which is going to become quite a feature of that landscape for the foreseeable future, I imagine. It's very clear as you drive in to town. 9.5 million spent there, and down in Withybush, 1.3 million spent, and over in Glangwili, 4 million spent on Women's and Children's Phase 2 scheme. So a significant investment in this part of the world, and of course this is before the investments that we need to make now in response to the strategic direction that we have set the Health Board. So just some words to summarise. It's the first year to reduce our deficit, and that's a significant achievement. And that goes without saying that we need to thank our staff partners, volunteers and the public. But it remains a very challenging outlook. The outlook for 1920 is challenging and difficult, and there will be some difficult discussions that need to be had in terms of controlling our expenditure this year. And there's a focus on reducing our deficit further as we look into 1920, 2021 and get to a sustainable balanced break-even position over the coming planning cycle. But we can only achieve that through working with partners across the public sector. And I think that will become a critical deciding factor and a critical element of our strategy going forward, where we're able to engage and work very constructively with partners across health and social care. So I am going to hand over to a video now as well. I think I only need to click, just a click. No comment about the narrator. I don't think that David Attenborough has much to worry about in his career.
Every hour of every day, we fuel our local NHS at Hywel Dda University Health Board to the tune of £105,000. Our annual spend is in the region of £920 million. To provide the healthcare communities need, we need to fund our staff, running costs, buildings, medicine, equipment and much, much more in our hospitals and in our communities. It is so important for us to know we're getting the best value for our patients, and we've done a lot of work. For the first year, we've met our financial targets which we agreed with the Welsh Government. There is much more we need to do, but for every one of us, whether staff or citizens, we can all play a part, whether big or small. Thank you to the staff who bring ideas and champion change for efficiency and value. Thank you to the members of the public who cancel their appointments when there's a problem. Thank you to staff who make wise choices to save money and protect our environment. Thank you every patient who chooses well when considering which health service they need. Our NHS is a precious resource. Together we can protect it, so it's there for when we need it the most.
Thank you, Hugh. That was quite something. That was meant positively. It's just now a very difficult act to follow, so thank you for that. But in many respects, we're now at the moment where we're going to think about the quality, the safety, the experience that our patients and those people that have used our services, wherever that has may been, what's that been like for them during 1819? So this element of the report, as with all the report, is intended to be a report from the board to the public. And I make no apologies for those of you that read the report online, that this is spelt out in words of one syllable. We've tried to make it as easy to read as we possibly can, but at the same time as informative as we possibly can as well. And what we've tried to do throughout the annual quality statement, as Hugh indicated in relation to the finances, is be open, be honest, be transparent in the care that we've provided and the impact and the outcomes that those that have received the care have experienced. So this is setting out how we've gone about providing our care, what care we've provided, and thinking about it from a very patient-centred perspective. It's also hopefully demonstrating that we have delivered care consistently with in dignified way, but also with the compassion and the kindness that we would all hope to receive care if we were patients. So the report is actually centred around the healthcare standards, the healthcare of which there are 7 domains: staying healthy, and obviously thinking about our health and well-being strategy and the preventative work that we need to be doing to maintain the health and well-being of our population. Safe care, are we keeping people safe from harm when we're going about doing our business and providing them with the care that they need? Effective care, are we delivering care in the most effective and efficient way possible? Dignified care, timely care, are people receiving care at the right time in the right place? And are they actually involved in the decisions about the care that they receive? Individual care. And obviously it can sometimes be easy to forget that they are individual people that come into our care settings in a busy working environment. But at every time in the care pathway, we're trying to focus on the individual and what their needs are. And then, of course, most importantly, from a staff perspective is thinking about, as you've heard from both Steve and from Hugh, the fact that we can't deliver any of this without having the right level of resource and staffing, importantly, in place in whichever setting care is provided. So this year I was very, very pleased that the board agreed the Quality Improvement Strategic Framework. For us as an organisation, this is what is going to ensure that we provide care and have that golden thread of quality running through all that we do. So we strive to deliver excellent, compassionate, kind services. And through the 5 quality goals that we've identified within our strategic framework, it sets out the areas around which our healthcare standards are going to be delivered. They're fairly simple, broad spread quality goals, but they're important because these will flow through everything that we do, focusing around no avoidable deaths, thinking about protecting patients from avoidable harm, so things like pressure damage, falls for example, reducing duplication and eliminating waste, reducing unwarranted variation, and increasing reliability, and that's fairly critical in how we move forward, particularly thinking about our transforming clinical services work that we're going to be doing across the organisation. And perhaps most importantly, focusing on what matters to our patients, service users, their families, carers, and of course our staff. Throughout the annual quality statement, you'll see that we've used a design that is hopefully easy to read. It's pictorial. We do have an easy read quality statement as well, but it's intended that as you read it, you'll see these designs flowing through. So, staying healthy, what have we been up to and what have we actually delivered? So our collaborative work with Swansea University, Hywel Dda, and now obviously the newly named Swansea Bay University Health Board has helped us bring some focus and attention to a number of critical areas: cardiology regional services, neurology conditions, and developing our thinking around the hyperacute stroke facilities as well, just to name but a few. There's also the work that we've been doing around antibiotic resistance. And it's never miss an opportunity to deliver a message. But actually, we are over-reliant on antibiotics within our population across the UK. And we critically need to do some work in driving down antibiotic usage, which is leading to antibiotic resistance. And that is something we're taking extremely seriously here within the organisation, working not just in secondary care, but also with our primary care providers as well. And of course, the work that we've been doing with our sexual health services and the development of our sexual health home testing kits. So we've actually issued during the last year 386 kits that have been used predominantly by 16 to 34-year-olds. That's a step forward. That's the future of how we deliver care, thinking about doing it in a different way. Social prescribing, another example of how we've seen changes in the way we support individuals to actually not necessarily rely on medication, but actually receive a variety of interventions away from the prescription pad. And of course, Ros would tell me off as the Director of Public Health if I didn't call out the fact that we've actually also been supporting very successfully the Stop Smoking, and 1,019 people supported between April and September of last year. So we haven't got the full year figure for me to give to you today. But actually, that's a significant number of people that have actually had a lifestyle change, which will ultimately affect their overarching health and the use of our services going forward. If I think about safe care, and as I said, one of our quality aims is about reducing avoidable deaths, no avoidable deaths, and reducing harm to our patients, and infection prevention being one of our core areas, I can advise that we have actually seen a reduction in our C. difficile infection rates and also our E. coli bloodstream infection rates as well. And in fact, in the E. coli situation, we reduced by 22% last year. That's significant. And I think what's important to remind people is that infection isn't just about the burden on our hospitals. This is about our community and our population as a whole. So the work that we've been doing, looking at how we work with nursing homes, residential homes, looking at urine testing, a whole range of things, looking at hydration, and I will confess I'm the one that's been going around putting posters on the back of doors to try and help people understand how important it is to hydrate. So I make no apologies for that, but I will make a confession. Sepsis, obviously really important. It's a high-profile condition that people have heard a lot about in the news and the media. We've been doing a lot to support training of our staff and actually improve recognition, treatment and management of sepsis, not just in the hospitals, but increasingly you will hear about how we go forward doing it in the community as well. Plus as well, our work with the Lucy Faithfull Foundation, particularly in Ceredigion, which is a really important piece of work. We also, and I have to call this out, are one of the top performing health boards in Wales around our stroke management. And that's the testament to the staff and that are going forward and actually implementing to make sure that our patients have appropriate access to hospital care within 4 hours, CT scanning within an hour. So these are important things that make a difference to our patients' outcomes. We've also had a number of healthcare inspection, Health Inspectorate Wales inspections across the year. And on the whole, those have largely been very positive. But obviously, being open and honest, I can't stand here and say that we've got everything right. There are definitely areas for us to improve upon, and that will reflect within the way we go forward and the action plans that we put in place. Plus as well, work with the Public Service Ombudsman for Wales, and the engagement that we've had with his office. That's important, and what we have seen in the last year is a 47% reduction in cases that go forward to the Public Service Ombudsman for investigation. I believe that's testament to the work that we're doing to try and meet patients and understand their concerns and their complaints at the earliest possible opportunity and provide them with detailed responses in a language that they can understand and interaction and further ask questions about. So moving on in terms of effective care, and again, we've been very busy here looking at the work that we've been doing around the hip fracture pathway, piloting and testing new documentation to support consistency and reliability in the way we're dealing with hip fractures. Looking at the South Carmarthen Rapid Access Multidisciplinary Service, the SCRAM service, and thinking about the 266 patients that were seen between September 18 and April of this year, the 293 medications that were stopped as a consequence of the intervention, and the fact that the GP records were updated the same day that the pharmacist reviewed the patient. That's good stuff, and we need more of it. Also, the patient knows best, looking at our text messaging service and making sure that we're absolutely utilising the resources to maximum effect. Together with the improvements that we've seen in our obstetric and neonatal facilities, and obviously the work that's going on in Cardigan around the facilities that Hugh called out as well. In terms of digital dignified care, the digital reminiscence therapy work that's going on in 2 of our elderly care wards is excellent stuff. It seems so simple, but it really makes a difference to the patients and the families that we care for. Thinking about the work that's gone on in Glangwili around the Welsh Parlour. So again, people who have got cognitive impairment, confusion, etc., trying to make environments as familiar as they possibly can so that our patients can function at their best. Multidisciplinary care assessment meeting, and that's the work that we're doing around learning disabilities, and also the work that we're doing around our bladder and bowel care expert patient programme as well. So a lot going on to try and improve the dignity of the services that our patients experience. Timely care. Hugh's already called out the changes that were introduced and rolled out across our organisation through the access to 111 and obviously the GP out of hours and NHS direct services. The pharmacy walk-in centres is something I do have to call out because actually we've got 93 community pharmacists supporting a different way of working and supporting see and advise, see and treat as we move forward in terms of changing the way we're delivering services. And of course, as Hugh indicated, the improvement in our waiting times from referral to treatment. That's come because our staff have worked incredibly hard. The text messaging services, the DNA rates, all of that combined has enabled us to improve the experience of our patients who are waiting for care. Individual care, I've mentioned the messaging services and the appointment reminders so that, again, people aren't missing their appointments and they can access care in a timely way. Thinking about the partnership that we've had with the Armed Forces Forum and the Regional Covenant Group, looking at how we can ensure that we're doing the right thing for veterans and adhering to policy guidance. And we've also done a piece of work which will continue to be rolled out through the coming year around listening to the voice of the child and young person. And I think hopefully this time next year I'll be able to give you some further update and information on the impact that that work has actually had. And then of course, Hugh very kindly introduced his section in Welsh. The drive that we are having with our staff to ensure that those patients who have first language Welsh can receive their care in that language as well. And that's why our staff are actually working hard to learn Welsh in a number of areas. So what about our staff? So 2018 saw the continued work around the Grow Your Own programme. What we do know is that whilst there has been international recruitment and we are very, very fortunate to have a wide range of staff, we need to grow our own, particularly in nursing, therapy colleagues especially. And that work is continuing. And this time next year, I'll hopefully be standing here talking about the success of the recently launched apprenticeship programme, which Lisa, our Workforce and OD Director, has taken a lead in for us. We've got the Aspiring Medical Leadership Programme as well, which is supporting our medical colleagues to become leaders and take forward innovations, changes, developments, exemplar projects that we're taking forward, the Hywel Hub, the work that we're doing, Engage to Change, in particular around our learning disability and autism spectrum disorder. And last week at board, we were very pleased to sign the Learning Disability Charter. So watch this space. There will inevitably be more for me to report back next year. And of course, there were various awards. And as it was highlighted earlier, I'm really proud of the fact that we've got Emma Thomas, who is the RCM Midwife of the Year for Wales this year, and the work that she's done around Emma's diary, and likewise Evie Lightfoot, who has taken forward and is RCN Nurse of the Year for Wales, and has taken forward the work, as I mentioned earlier, around sepsis and looking at how we're rolling that out in the community. But our work is not done. There's so much more that we need to do. And we've pulled together a number of priorities that we're going to be taking forward during the coming year. So you heard about the vaccination position, more than we've ever given before, but we know we can do more. Thinking about smoking rates in pregnancy, that's going to be something that our maternity services colleagues are focusing on. Sepsis, more work for us to do on that. You know, scoring 95 and 100%, that's okay, but we need to be 100% consistently in all of our areas. Looking at what we're doing around hospital-acquired thrombosis, and there is some more work that we need to do on that. And I mentioned earlier about harm for patients and pressure damage. And I was really pleased to go to one of our wards earlier this year, in fact this month, to reward them with some cake for being 200 days pressure damage free. Now that might not sound like a lot, but actually that's a significant achievement, and we need to recognise those steps of improvement, no matter how small they may be. We're also going to be this year further rolling out the work that we've been doing around nursing documentation. So with that, we're also going to be focusing on the quality of our documentation as well. Effective care, I mentioned the hip fracture. We've got more work that we can do in terms of the pilot that we've been taking forward, and hopefully we will be rolling that out across the organisation. Likewise, the improvement in the care plans that we're putting in place for those people who have and need mental health services support. And there's more. Dignified care, as I've mentioned, that work will continue. In fact, it probably will never stop. the collaborative work that we're doing in terms of communication. And one thing that I didn't mention when I talked about the quality improvement framework is that to enable us to embed those 5 quality goals, we've commenced the EQUIP programme, Enabling Quality Improvement in Practice. And again, next year, I hope to be standing here talking to you about the outcomes of the 11 teams that have started on that programme. But actually, one of the collaboratives is looking at communication. So that's a really important piece of work. Timely care and ophthalmology in particular is an area that we will be focusing on, likewise orthodontic and dental care as well. And then, of course, implementation of our patient experience charter. So we're broaching new territory this coming year where we will be having a patient experience charter rather than a wordy strategy, and that's currently being worked through and consulted on with members of the public, as well, of course, of our implementation of our Welsh language standards. So it's been a busy year in 1819, and I've got, no doubts that 1920 is going to be as busy, if not busier, as we move forward. It was mentioned earlier that we have held probably one of the largest consultation events in the UK. And again, I think that that's been an excellent opportunity for us to have very direct, one-to-one group, meaningful conversations with our public, but also our staff in how we move forward in shaping, and now for 1920, really gearing up how we go about implementing our health and care strategy. We've also had our the work that we've been doing around the framework for health and well-being and our future generations, and that's a critical piece of work. Again, much like quality, will flow through everything we do. But we know there's much more to do, and together we will do that and make it better for not just our patients, but also our staff as well. So, as always, we'd welcome any comments, not just on the annual quality statement, but indeed on anything that we've presented here today. Thank you very much.
Bwrdd Dda, good afternoon. Hywel Dda University Health Board Health Charities is the official name of the Hywel Dda University Health Board. As an NHS charity, we raise and distribute funds to make a positive difference to our patients, our staff and services, above and beyond what NHS funding allows. As Chair of the Charitable Funds Committee, I'm pleased to present you with a visual summary of our activities during the last financial year, and I hope that this brief insight into the charity helps you to understand the vital role it plays in enhancing patient care and experiences across Pembrokeshire, Carmarthenshire and Ceredigion. Please note that further information on the charity and its operations for the year 2018-19 will be available in the charity's full annual report and accounts, which will be published in September 2018, following audit by the Wales Audit Office. And so hopefully, if the technology will cooperate,
thank you, everybody. I'm trying to edge forward to make sure that it's come to an end. I feel as though I ought to get up and sing, but I promise you I'm not going to. Well, I'd like to thank all the presenters, and I think it's really good when we have the interactive and the videos, and you know that's really helpful when you're sat listening. So it's now an opportunity if anyone in our audience would like to ask a question. If you could say who you are, and I'll direct the question to one of our team to answer it. So has anyone got any questions? Just wait, there will be a microphone.
Thank you. My name's Sue Reynolds from Royal College of Nursing. Can you hear me all right?
Yes.
Yeah, okay. Throughout the presentation, you frequently referred to valuing staff and how they've contributed to successes. And I was just going to ask a question which is staff related, and it's related to the managing attendance policy and the rapid access section in there about improving returning to work for people who've been off with ill health and with access to key services related to mental health and musculoskeletal conditions, and I was wondering if that is in place within the health board.
Okay, I'm going to ask our workforce director, Lisa Gosling, to answer that. So we'll get a microphone up to you, Lisa.
Hi. Yes, we do have access within our occupational health service. Oh, I thought I had a bit of backdrop then. We do have access to occupational therapists and physiotherapists within our occupational health team, so they provide the musculoskeletal support. We have a staff psychological and wellbeing service that covers the 3 counties of the organisation, where we provide psychological support to all of our staff. They're both areas that we are looking to assess this year to see if we need to further invest in any of those practitioners, but we do have a service in place for all of our staff.
Right, thank you. Thank you for the question. Thank you, Lisa. Any other questions? Thank you.
Good afternoon. It's Mansell Bennett, Chair of the Hywel Dda Community Health Council. It was mentioned in the quality report that you're working closely with community pharmacists in relation to the drop-in centres. And bearing in mind that the public are asked to choose well and to stop them going to GPs when not necessary, and indeed into the A&E units, can I ask what the Health Board is doing to signpost the public to these drop-in community centres?
Okay, who would like to answer that? Is that, I think, if I can ask Jill, our Director of Primary Care.
Thank you. The 12 walk-in centres are actually leading edge in terms of Wales, and we have to ensure as part of that arrangement that they achieve a certain number of enhanced services, and we're looking to expand that as we go forward over next year. Of the 99 community pharmacists as well, a number also do provide a range of enhanced services but may not achieve that level of status as yet, but we've got a number of other initiatives, including triage and treat, common ailment service, and medication review opportunities. So it is really important, as you say, that we make the most of those services to try to ensure that all of our services are used to the optimum. And so making that the information available on our website, but also through our primary care news centres. We've also distributed previously information to holiday and vacation resorts, etc., to try to ensure people through the holiday period that they're aware of the different opportunities that are available to them. So I think you're right that we continue to look for opportunities in terms of making those other services known to individuals and ensuring that our primary care services are available and can be used effectively on a 24/7 basis. Thank you.
Okay, thank you. Sarah, do you want to?
Yeah, I mean, Jill's covered most of it, but I don't know how many people in here have downloaded the Choose Well app onto their phone, but particularly for visitors to the 3 counties, of which obviously we're in the season where there are many. That app, if you literally just have location services turned on your phone, will tell you where your nearest GP, pharmacy, walk-in centre, etc. is, and it even gives you the directions by foot, car, bike, train, bus. So you know, that's a really easy way for people, whether they're local or whether they're from away and coming to visit, can very quickly find whatever that service is. So it's just the Choose Well app, and that brand is becoming more and more known in Wales, but we're publicising it quite significantly in places where our tourists would be as well.
Yeah, thank you, Sarah. Thank you for the question. Are there any other questions? No? Okay, well, thank you very much. Again, I'd just like to thank the presenters for providing the information in a really easy, accessible way. And just one final thing from me. I mentioned at the start that it has been an honour and a privilege to be the interim chair. But I think before we finish this annual general meeting, I do need to recognise all of the work undertaken by our previous chair, Bernadine Rees, who retired in February. And most of the year that you've heard about, she was at the helm, providing leadership to the Health Board. So I didn't want today to go past without us recognising her contribution. And with that, I will close the meeting and thank you all very much for attending. Thank you.